In Algonac, there is a high demand for a rehabilitation center for not only the younger generation, but also for the elderly who are typically sent to nursing homes for rehabilitation. With the right research, funding, and strategic planning, we can expand the community first and make it one of the largest healthcare systems in our area. Algonac and the surrounding cities can benefit from these types of services as our population is primarily the elderly and young adults. Let's break things down and look closely at ways to make this one of the best healthcare systems around. Algonac is a small population town of about 4,039 people. There are 3,231 adults, 700 of those are seniors. Out of that, there are 808 children. As of today, there are a few physical therapy places, 2 in Algonac to be exact, but there are no places for seniors to receive care after surgery and a hospital stay that requires rehabilitation. This could benefit our community and also utilize the doctors that practice within the area as well. The lack of facilities with these capabilities encourages patients to venture out of the community for care. Community First has 3 locations in St. Clair County. The first one being located in Algonac, another in New Haven, and another in Port Huron. In Algonac, we have First Healthcare Systems, and they have been established since 1975. We offer a wide variety of services from primary health care, family medicine, maternal infant health, and WIC, women and children care. They also have their own diagnostic center at each location and a laboratory. The physical therapists in our area are out of network. They don't work with Medicaid or Medicare insurances. There is a vacant building right next door to the Algonac location building. The building has sat empty for several years. The building is approximately 20,000 square feet. Rent for this building is $10,000 per month and equals to out to be $120,000 a year with the option to buy after 3 years. I have decided to create a 9-bed facility with 14 rooms total. It would include 9 beds, a reception area. It would include a shower room, a kitchen, a common room, and a physical therapy, occupational therapy room as well. Typically, the higher value of the property base rent the landlord will ask. However, the more leverage you have as a tenant, such as a long-term lease requirement, a large size requirement, good credit, etc., the more you should be able to negotiate the rate down. The landlord is willing to include the property tax and insurances that are required in the monthly rent. They would just like to see the building occupied. Now, in week 3, we learned about patient check-in services, emergency medical records, EMRs, and billing. With billing, patient check-ins would start with checking insurances, patient forms, claims filed for services, physician documented treatment plans, claim submissions to insurances, claim adjunctions, reimbursements from the insurance company, which states how much the insurance is willing to pay, a patient bill with outstanding balances, if any, and then a follow-up. And then after 60 days, be sent over to collections. Electronic medical records would be a great asset to have in our building because it allows us to communicate with all of our other physicians and their primary care physicians if they are involved. With electronic medical records, you have to build a team, prepare the software, determine the type of systems that we're going to use. Patient treatment rooms is where information is stored with security. We have to create a workflow. We have to train all of our staff on how to use the new electronic medical records and put the program in place. The launching of the program, receiving feedback from our patients, and then audits annually so that we know how we're doing with it or where we need to fix and find a better suitable place for it. The problem that we may encounter is having the funding to cover the cost of opening a new facility and maintaining the rent and having adequate staff. To maintain the building, we would have to have an HVAC system. This is our heating and cooling system and also our lighting system. This can be rather costly, which it will cost $500,000 to install with the correct system of that size of a building. Monthly maintenance, roughly $5,000 a month. We also have to factor in water bills and gas bills, which are generally between $2,000 and $4,000 a month. Our staffing is what's going to be our biggest challenge, as we need nurses, we need nurses aides, we need kitchen staff, we need cleaning staff, we need receptionists, we need physical therapists, occupational therapists, and we also need maintenance for the grounds and the building. With staffing, we're looking at roughly $840,000 per year to cover all of our staffing. With community first health systems already established and having multiple locations, we would need to take out a large principal loan. This financing offer existing homes with large amounts of capital. They normally start around $1 million in size. Homes must put down collateral. They also must pass certain credit and business worthiness standards. Once secured, the loan can be used for a variety of purposes. In some cases, these loans can be obtained through the government, housing and urban development. With this, we were looking at a $1.6 million loan. This would cover all costs for the first year with staffing, rent, and being able to make payments back on the loan without falling behind. As this facility runs and operates and we receive more revenue, I see this taking off. My recommendation is to use the other locations as our collateral and borrow on those facilities, as they have been in service for a many number of years, that this is a great borrowing tool to use. There are also many grants that are open for rehabilitation centers, especially with running an HVAC system. There are many benefits to using that. They offer tax write-offs. They offer money-saving grants where they come in and audit your system, and they allow you to find ways to save more money and keep your bill stable, where it's the same every month. We also have the option of bringing in a private practice, physical therapists, and occupational therapists. Their home would be our office, but they would bring their patients with them to our facility, which is a great thing for us because not only can they work with the healthcare systems they're with now, but they can also work with the hospitals and bring in more revenue. This will allow us to meet our rent, monthly rents, and allow us to keep our workflow going. For this type of facility, we can open up a range of new care and provide the community with the best possible care. There is always going to be a need for care for any type of patient, whether they are elderly or children, or even young adults. Physical therapy is in high demand as there's not enough that participate in the network of most insurances. With the way we see insurances these days, they are beginning to cover less unless they agree to work with the insurance companies and Medicare and Medicaid. This could bring so much to a small